So the first thing we often teach when it comes to any functional rehab strategies is how to breathe optimally. And when we learn how to breathe optimally, or the way that we were designed to breathe as human beings, it gives us a wonderful foundation on which to then apply more broader general rehab concepts to, that'll make you a more functional person and get better outcomes with your rehabilitation process. So I think it's important to understand what is ideal when it comes to respiration and breathing and stabilization, and what are some common faults that we see. So in an ideal world, as we breathe in and our lungs fill with air, we have our diaphragm, which lives at the bottom of our rib cage. It's a big flat muscle. It goes all the way around. That's a muscle. And as we breathe in, that muscle contracts and the diaphragm will drop down into the abdominal cavity. As it does this, it pushes the abdominal contents outwards. Our abdominal wall will eccentrically contract to kind of hold everything together. And then our pelvic floor, which is the opposite of the diaphragm, kind of stabilizes it from the bottom side. So that's ideal. We breathe in, diaphragm drops, we get intra-abdominal pressure, everything's good. Now, a lot of faults can happen, and normally it's just a couple of the same faults that we'll see repetitively. And this is often because of poor posture, poor movement patterns repetitively over time. There is a vanity thing here, so we're oftentimes told to suck in our stomach so we look better, I guess, or maybe we're not told to, but we do. This is going to change breathing dysfunction probably more than anything. That and prolonged sitting, and then of course previous injury has an effect on this stuff as well. But some poor patterns that we commonly see, one is called an open scissored posture, or more of a flared rib cage posture. So in order to correct, or one strategy that's often used to correct this slouched posture that we see so often in our lives, is to bring the shoulders back and bring the chest up. And that there's a time and place for that, but I think it tends to be overdone. And what happens is, as we bring that chest up, our ribs will start to flare upwards. And as our ribs flare up, it kind of makes instead of our diaphragm sitting flat like it should, it starts to angle up a little bit. And in this angled position, the diaphragm is at a mechanical disadvantage, and it can't drop down the way that it should optimally. So in order to inflate the air with lungs, because we still have to breathe, we start to recruit all of these accessory muscles of respiration, our upper traps, our levators, our scalenes. These are all now lifting the ribs up in order to get air into the lungs. But over time, this can lead to disaster and tons of dysfunction down the road. The other side of that is going to be an anterior pelvic tilt, most oftentimes, where we have this kind of butt that almost sticks out, or our lumbar erectors that tend to get really, really locked on here. Our pelvis starts to dip forward a little bit, and it's the same thing. Now our pelvic floor is kind of angled, and our pelvic floor can't serve its function to create that reciprocal pressure, intra-abdominal pressure that we're trying to initiate from the diaphragm. And in the worst case scenario, we have both an anterior pelvic tilt and a flared rib cage, what we would call an open scissored posture. So you're just really in this gross extension moment. We put a lot of compression here in our TL junction, and we just can't get optimal firing of the diaphragm. Now, I do want to discuss the difference between intra-abdominal pressure and bracing the spine. Bracing the spine is a concentric contraction of the abdominal wall. It tightens everything together, it buttresses our spine, and it allows us to stay nice and tight and compressed with things, lifting heavy objects, like doing a squat or a deadlift or something of that variation. Intra-abdominal pressure is a little bit more subtle. It's the eccentric control or eccentric contraction of that abdominal wall that creates pressure. And the difference is, yes, you're getting intra-abdominal pressure with a bracing strategy. However, it's non-ideal. If you're just sitting at your computer working, or you're, maybe just bending over to tie your shoe, we don't want to brace for that. That's just too much compression for the system. But we do want intra-abdominal pressure. We do want optimal breathing. Now, how do we get that? So the number one thing that we're going to start with is you're going to lie on the floor. Probably we need a harder surface, so a bed or a couch isn't quite going to do it. And the first thing we want to do is try and find flat. We want our lumbar spine and our TL junction to be flat on the table. If we're in that open scissors posture, as the ribs flare up, you're just not going to you're going to have a gap here between the table and your back. So we want to close that gap as much as we can. So you may have to tilt the pelvis a little bit to get that to flatten out. We may have to do almost like a little crunch to get that to flatten out before we let our head go back. But once we get that, now what we want is our head to be back, and you can have a little support, that's okay. But we want to bring our chin back, kind of like we're making a double chin. We should feel these muscles in the front of our neck start to fire a little bit. From there, rib cage comes in a downward position. So sometimes you can breathe out forcefully, and that will help draw the rib cage down. Turn on that abdominal wall to hold them in that position. Now, if we have a very dominant chest pattern of breathing, it's going to be difficult to do this the first time. So you may start with just a hand on the belly and a hand on the chest. And all you're going to do is just try, as you breathe, is try and get movement from this bottom hand where the belly is expanding and try to quiet down this movement through the chest. So just being aware of that, even just to start, just to get your brain to rewire in these positions, maybe where we have to go first. But ideally in this position, what we're going to do is we're going to take our two fingers right on the inside of our ASIS, or our hip pointer, the soft part of the abdominal wall kind of down here. And our thumbs are going to stick right in this QL muscle area where there's a soft spot in the lower back. And from here, I'm going to give just a little pressure into my abdominal wall with my fingers. And I want to brace. I want to create a little bit of tension and push outwards against my fingers into this position. Now, when I breathe in, you should feel some expansion or more pressure build into your fingers. And as you breathe out, I want you to try to maintain that tension or that pressure. It's oftentimes really easy to get the pressure on the inhale, but then we'll lose it on the exhale. So try and maintain that pressure consistently through both the inhale and the exhale. So with basic breathing, this is all we're doing right here. Maintaining that intra-abdominal pressure. Do as many breath cycles as you'd like. I normally tell people to spend 2 to 5 minutes in this position, maybe twice a day. You can always tune into this throughout the day. So if you're sitting at your desk, you can go right here from a seated position, tune in. What's my intra-abdominal pressure doing? Maybe you're at the gym and you're doing some kind of stretch or some kind of exercise. Maybe you tune in here, see what is my intra-abdominal pressure doing. That is how we breathe optimally.